from AYUSH SAMRIDDHI, and due to your overwhelming blessings, rather I can say, our journey is now being arrived into 2776. Now number is also not the matter. So 2766. Thank you, sir. Thank you very much. Thank you, AVTAR, sir. We welcome by heart our respected Ayurveda Ratna, Ayur Dr. AVTAR Singh, renowned herbal medicinal practitioner, founder of Siddha Ayurveda Clinic and Academy and Research Center from London, UK. Welcome, sir. Welcome. Your concepts are exclusive, no doubt, and your subjects are unique. So today is also very unique subject, reverse Crohn's disease with Ayurveda. So I would like to welcome our other participants also, Dr. Shweta Kulkarni, Ila Patel ji. Welcome both. Welcome. So without wasting much time, I would like to invite Dr. AVTAR Singh, sir. Welcome, sir, for your blessings.
Thank you very much. It's this kind of disease, lot of. Pehle to, first I have to say everybody hello, namaskar. Thanks very much, all the participants. Ayurveda, I can say, people are suffering many kind of disease they call. And Crohn disease is also one of them. Many countries in the European country, they suffer more. American country, they suffer more. Even in India is also suffering this one. Crohn disease is the gut disease. And why we patient got that one? Why the suffering? There's so many reasons. According to the research society, so many allopathic societies also researching on that one. In Ayurveda also we have the lot of information inside. But new type of disease, many. The big thing I think we have to appreciate, like we are speaking before, technology. Nowadays, world is become very small. We can learn from each other. Allopathy have one great thing. They do lot of researches. Doesn't matter any problem, any disease, any kind of the health issues. They start working on that one. And they collect lot of information. That is, I think, is a great thing they're doing. I always appreciate them. I always respect them. They done many things, miracles, many things which one not normal person can find out. Not every physician, doesn't matter any kind of, don't put the name only. Very difficult to diagnose. But if we Ayurveda people start researching what they research, studying on that one, we can find many things. Ayurveda have the great thing. We have the treatments. As I many times discuss on that one. I'm the researcher. I made my own formulations. Most of them make the custom-made medication for the patient. I won't rely on all the pharmacies. Pharmacy doing what they can do the best. But patient need these kind of the disease when they're suffering. They need custom medication, custom-made medications, individually, like a Crohn disease. In the allopathy, they'd done the research because I'm a member of them, and I got the research. Anybody can become the member of them. I always say, I recommend to their research associations, better every Ayurveda practitioner, with doctor, whatever we say, we have to become their member. There's a free membership. You can get a lot of knowledge, what is going on nowadays, what is the new research is coming, which in the Ayush ministry or Ayurveda system, we also have very similar kind of the researches. These kind of case I done, IBS, ulcerative colitis, Crohn disease, celiac disease, I done the treatments because I find out what actually is the problem, what is the root cause there. Then Ayurveda is the best medication, best system to handle every type of problems. Many think allopathy is so far yet to do the treatments, but Ayurveda can help them. Ayurveda can, I say sometime, many times, I say if Ayurveda and allopathy start working together, then we can give the whole world very good health. We can give the good health to the patients. Also, we can save a lot of money, lot of pain, but patients suffer unnecessarily. I don't know when that time is come, when all the therapies work together. And all the therapists become honest. This is also I tell. Many, they have the egos. Even Ayurveda people have every therapist, they have the egos. Every therapy, they say, no, we are the best. What we doing, that is the best. No. All doesn't matter, any kind of the physician. We have some responsibilities. Should not be ego. We should responsible what we doing. We should be honest with the patients. What can we help them? If we don't know, then we have to learn more. And straightway we have to say the patient, sorry, I don't know this one. I use many times this word. Like I'm doing, I always say, first or second stage of the patients, anytime any patient come to me, I say, if you can't get benefit from my medication within 2 weeks, better you go somewhere else. I don't take the case if I don't understand. That is 100% I'm doing. With me in the UK, many my friends, they know very well. Dr. Joshi, Dr. Raghunandan Swarnapuri, Dr. Kapil Chawla, then other one, they know Dr. Neha Sharma, they know me. If this is my word to every my patient, I'm just requesting every Ayurveda practitioner, please, my first responsibility is my Ayurveda. We want to tell the people do for the people work what we're doing, do the with the 100%, not experiment to use on the patients. Do, if you know the knowledge, do 1 week, 2 weeks. If you can't do it, say, sorry, better either find somebody else, which one who doing better job than you. I do this one. I always discuss with these colleagues. If anything, if they do it, I recommend to them. But they respect me very much. It's not much chances I have like this one. If I took the case and not get the patient, not get the benefit. Most of them, 99% patients, they are happy. Doesn't matter what condition. First stage or fourth stage. I'm not doing the treatment. Ayurveda doing the treatment. I learn Ayurveda, I'm practicing Ayurveda, doing honestly, making my own medications. I just, what I learn, I'm following that one. What Ayurveda is saying, I'm following that one. And very carefully. Medication, we all know what kind of medication, how we make it, that one, what is the strength of the medication. If the medication is very old, they won't work. That is the reason I got a result. This is Crohn disease. I sent to Dr. Pawan the one case I recently done. Within 4 weeks, he start eating dairy products, yogurt, cheese, and his pain is gone. His appetite is within 6 weeks start working 100%. And he was suffering from a long time. He not taking any steroid anymore. No steroid. And this is what I'm saying. We have to be. Ayurveda is a very great science. We have to find out actually what is the area, what is the cause of the problem, Crohn disease. Problem is patients also, especially in our society, they are not going to the professional people in the beginning. Why the Crohn disease become aggressive or very, we can say that untreatable, and then patient don't have any other choice to take the steroid, painkillers. This pain, we have the more patients, but these patients allow me to put all the things we can show the people. Many people, many patients, they don't want to be shared with their. But this one is, I think is, thanks David, you allow me last week. And I'm doing this one for many people. We know that at least 10-15% people are suffering, 20% at least suffering from the gut issues. Maybe people can get from the benefit from the Ayurveda. And my colleague, Ayurveda colleague, they can ask me the question today, how can we reverse this one? I'm happy to give their answers. But we have to first learn what is the actually problem, where these problems are started. And you can see the people suffering from many years. Now they are enjoying their life. Not only one. I treated so many IBS, ulcerative colitis, and like this one. I have the patient people in 6 feet, 2 inches, 3 inches, their weight become 50 kilos, 52 kilo. After the proper treatment, many I done 4 years ago, 5 years ago, 3 years ago, they are working now. Their weight is put on a weight again. like this patient is told that one, he's eating properly, 100%, his appetite is working 100%. Almost 90% he's feeling no tiredness anymore. And this patient, we have the, he told me, I'm surprised myself. Within 5-6 weeks, his energy level become, he say, I not believe him when he said, his wife was with him. He say, doctor, yesterday I walked 9 miles. Continue. That reason we kept this. I'm surprised that one. Ayurveda can't do anything, my friends. Trust on Ayurveda, but only Ayurveda can work if we do what Ayurveda is saying, what Ayurveda need to do it properly. Not Ayurveda formulations not work until you know how to use those formulations. What is the quantity you need for the patient? What is the kind of problem? This all matter. Not the dose, what the pharmacy is recommended. Then we are doing same problem like other allopathic pharmacy doing that one. Don't work like a chemist. Work like a physician, work like a Vaidya, work like a consultant. I'm doing that one. And when he told me, I shocked. 9 miles, are you sure? He said, yes, I'm not lying. I'm very happy. And he's eating almost everything now. And no any more pain. Everybody know what is the Crohn disease. There's in the endoscopy, they said you have the damage inside the small intestine, and colon, they have the polyps on that one. He have no any more pain. He tried to pressing deep, very hard. He said when his wife say he's all the time checking. He was shocked before. He was always depressed or anything. Many reasons why gut problem we have. You have to look after not only one thing, what is the problem is suffering patient. No, that is not the solution. That is not the treatment. Then we are same thing like they're giving the steroid and painkillers and anti-inflammatory drugs, that one. We're doing same thing. Now, find out what is the cause of that one, what area is damaged, and how can we repair that one. I told many times, first we have to remove the inflammation from there. In Ayurveda, so many drugs, so many things we have, but all things we can't give to everyone. That is, they have to be designed your own. What person can take it and observe it in there? What is the condition of their liver? What is the condition of their appetite? What is the condition of in the intestine? Not same what the pharmacy made the drug. Take it this one for the Singrani, this is take for this one, that one, do that. We have to find out. That's what I'm doing. I'm telling you. I'm not hiding anything. How I got the result? Because I'm not use what the pharmacy said. What is the written inside? Give this one for the diarrhea, give this one for the painkiller. No. Is what kind of pain? If the intestine inside the damage, you have to repair first that one. That's the reason a lot of bacteria is there, and a person is suffering from the pain, all that bloating and everything. Sometimes bleeding come. We have to repair for intestine. In Ayurveda, we have a lot of things. Take the Vata Pitta Prakriti of the patient, what I am doing, and then I give the medication to take the inflammation out. As soon as your inflammation is came down, infection automatically removed from there, because make the circulation better, make the oxygen level better. Not only one thing work, medication, not only medication work that time. That time you need diet, you need to make the oxygen level more high. I'm doing that one. That is the result. If you ask how I handle these kind of case, that is my theory. In any kind of disease, any kind of health problem, doesn't matter, cancer, doesn't matter, kidney, doesn't matter. In our body, there's not only one organ individually working. All the organs are working together. Not one organ is responsible for our health. All the organ, all the endocrine system, all the glands we working together, brain, gut, everything, lungs, everything. We need to be look after all body, which area is going slowing down. If we start working on that one, then any kind of disease, not only Crohn disease, within a week, I have his weekly report before. Patients start feeling better. Patients start saying you, thank you very much. I'm sleeping well. I'm eating 10, 20, 30% better now. I have reduced my pain without any painkiller. I never give any painkiller. What is the pain? Where is the pain? What is the reason of pain? I handle that one. What is the reason of pain in the instant time? Damage instant time. They have the infection then. How that one become the inflammation, how that area is become the ruptured inside, scars inside how the polyps come that one. That's so that area is in the colon area and the small intestine area, all the malacia area, they belong to that area. It's all the time bacteria, they are parasites, they are all the bad things all staying in there. If they stay too long, then other area become the problem. We have to be handle that one. I'm not say learn, because all the Ayurveda practitioner, I think they are better than me. They have more knowledge than me. But just concentrate on that one. Everybody learn everything. But how deeply, how nicely they learn, that is most important. That one I definitely say. If you just passed your exam 33%, then you know only 33% Ayurveda. If you not done that time, do it again, until you not solve your become some standard. Don't stop that one. When I was learning in the Gurukul, my father was my guru. I have two other gurus. That time, all the gurus told me, my father have the different kind of theory. After 2 years of learning, 1.5 years, if the student once in 1 year know the body internal system, then he say, learn the medication, how to make it, Ayurveda medication. After that one, when they learn something good, then he say, what kind of the disease you want to handle? You want to liver problem, heart problem, skin problem, stomach problem, brain problem. Just work on that one. Because one you start learn, because every organ is related to each other, then definitely you learn other one automatically. There's not individual part working individually. It's whole body part, whole body organs, whole body system working together. Is that policy I'm talking about more than 60 years. That time we don't have any university in my area where I born. That time we done the DAUMS on the local Punjab government, and then Ved Vishal. That time we learn like this one. And if I am successful now, I got the lot of results better, good result, only the reason which way we learned. That time was no any fees. Nowadays, I seen that student pay their fee in the in the university, they say we paid the fee, we got the certificate. There's one 2-3 weeks ago, Ayurveda, he done the Ayurveda and he gave me the one message. That one I learned why Ayurveda people, so many Ayurveda people not very successful. They are looking, oh, my university is better than other university. They are not looking, I am better than other Vedya or not. No. They are say these certificates are better than any university. I surprised. I was thinking, all learning Ayurveda, government helping them, Ayush Ministry giving their best, I think, this one in the last 70 years, universities came in so many university came. And Ayush Ministry from last 10, 12 years, they're doing their best. And what Ayurveda people thinking? Which university is best? No, university syllabus have same. BMS syllabus same anywhere. But they think we are learn from the better university. I think no. Doesn't matter small college, doesn't matter university, doesn't matter college in the UK we have the very good college. Dr. Sonpuri and Dr. Joshi have the AA Academy. And also so many other academies in the UK they're working. But I think they are Dr. Sonpuri and they're doing very well. And others also know they're doing very well. Dr. Pleetha doing, Dr. Atik done so many years for the College of Ayurveda. They teach so many people. Dr. Godakama doing that one. In UK, my colleague, my friends, they are senior than me. And they're doing very well. They've done very well. But need more information, need more knowledge, proper way. If we don't do that one, doesn't matter how many college, university, where from you, doesn't matter any university. He says, when he said this one, then I got the answer from. Because I know the many Ayurveda practitioners. And also, I mentioned before that one, what their attitude, what they are thinking, and how much they know. I don't shy to say this one. That is, and I many times say, only 20% Ayurveda people are the great. I can't match them even myself. They are a lot better than me, but they're doing their great job. If other 80% also start learning that one from them, in India have a lot of great people, lot of great teachers who doing their best. You should go there from there. Then you know how to do the treatments. Books not tell you how you do the treatments. Treatment you have to learn practically. That is the biggest mistake. And that person from last 30 years, he BMS, MD, and I can't say more than this one. What I told to him, I say, now I got the answer. I was always thinking, we have maybe 1 million people Ayurveda practitioner at the moment in the India. Is 1 million Ayurveda doctors. I don't think so. Allopathy have 1 million, and still we are not reach any stage. Still, people are first choice are allopathy. Why? Think about. Ayurveda can do it like in this case. If I can do it, you can do it too. Everyone can do it. But we have to be united. We have to learn. Don't shy. Don't stay in the ego. Doesn't matter you have the 20 PhDs. Treatment not work with the certificates. At the moment, people attitude, they say we have the big degrees. His attitude shocked me and hurt me. And he was my patient too. When he said to me this one, when I said something, why not you learning properly? I am the best university student and best this certificate. When he said to me, it very much hurt that one last week. Please, your certificates not give the treatment to any patient. Your knowledge, your practice, your how you learn that one to for, do it. You can do it. Not difficult. Do more study. Which case you want to do it? Give to patient 2 days. Go to the internet. Google can tell you what is this problem. Then match with Ayurveda medication. If you know it, ask your friends. Keep friendly with each other. Don't say in the ego, I have the big degree, I am the small degree. And here I am I done only, I have the degree only postgraduate from here, from the College of Ayurveda. But I have the Dr. Joshi PhD. We discussing like friends. We not shy from each other. Dr. Raghunandan, me, Kapil Chawla, and other, we have 4 5 Dr. Swanpuri. We discuss that one. They discuss to me, they never shy. They ask me, no. I say, you got the big degree. No. They say, no, what is this is actual. Then I tell them, we're doing very well. In India, we also do this one. Now, anytime anybody asks me any question, no problem. This program, Dr. Pawan doing, I'm surprised only few people come on that one. This is, we're not selling anything. I'm not selling anything. He's not selling anything. We offer and come here. If you know everything, don't stay in the ego. Better you come in the program. He's doing from last, I think, 6 7 months, every week, my program. We done so many programs. Few people, they come and ask the question, what's the relevant of the problem? Then I can share with them what is this one, what is in my knowledge, how can I treat it, this one, this case. Every case is individually should be treated. Formulation, as I told you, never work. You have to find out what is the problem. And this is today's case, like a Crohn disease, there's so many type of that one. Become very big.
So,
We
if you
have to be.
kindly permit me, sir, if you
And
kindly permit me,
yes, sir.
you have really given an outside of the autoimmune disorder as well as Ayurvedic world as well as the ethics of Ayurvedic world. With your kind permission, I would like to communicate few facts on Crohn's disease.
Yes.
It's an idiopathic, chronic, transmural inflammatory process of the bowel that can affect any part of the GIT
Yeah.
from mouth to anus.
Hmm.
Most cases involve the small bowel, particularly the
Yeah.
terminal ileum.
Hmm.
If we talk about history of this, in 1806, first reported case of Crohn's by Combe and Sanders to the Royal College of Physicians in London, England.
Mm-hmm.
So it's the history of England, data history of England, but otherwise the disease definitely it was existed right from the beginning of life, no doubt. And in our Ayurveda, we are dealing with Apan Vayu for this type of disease. 1913, surgical evidence of the disease reported in the paper Chronic Intestinal Enteritis, written by
Mm-hmm.
Dr. Kennedy.
Mm-hmm.
In 1932, by Crohn, Ginsberg, and Oppenheimer of Mount Sinai Hospital in New York, they have described this disease. So, Crohn's disease, we are communicating this.
Mm-hmm.
Prevalence, if we talk about prevalence of the disease, higher number of cases of Crohn's disease found in Western industrialized nations. Male and females are equally affected.
Yeah.
Smokers are 3 times more likely to develop Crohn's disease.
Mhm.
So it is warning signal for smokers. Please don't smoke, otherwise you will be the target of Crohn's disease.
Mhm.
Crohn's disease affects between 4 lakh and 6 lakh people in North America.
Mhm.
Prevalence estimates for Northern Europe have ranged from 27 to 48 per lakh.
Mhm.
Crohn's disease tends to present initially in the teens and 20s,
Mhm.
means this is the biggest spectrum of the disease.
Mhm.
Malati and Shivwalan reported CD cases in southern India also.
Mhm.
If we talk about classification of the disease, ileocolic Crohn's disease affects both the ileum and large intestine. It contributes to more over 50%. Crohn's ileitis affects the ileum only.
Mhm.
So ileocolic was the 50%, and it affects both ileum and large intestine. And
Mhm.
Crohn's ileitis was affects the ileum only
Mhm.
30%.
Mhm.
Crohn's colitis affects the large intestine, accounts for the remaining 20% of the
Mhm.
cases. So 100% is done. This
Mhm.
is the distribution of the cases: 50% ileocolic and then ileal and colic. On the behavior of the disease as it progresses, stricturing. Stricturing means this is narrowing of the bowel, which may lead to bowel obstruction or changes in caliber of the feces. Penetrating. This create abdominal passage way between the bowel and other structures such as skin, like sinus or fistula. Inflammatory disease cause inflammation without causing stricture or fistula. So inflammatory. So penetrating is there, inflammatory is there, stricturing is there. Now, symptoms: onset of Crohn's disease is between 15 to 30 years of age. People will with Crohn's disease will go through periods of flares up and remission. Endoscopy, gastrointestinal symptom if we talk about
Mhm.
abdominal pain, diarrhea, flatulence, bloating, perianal discomfort. People who have had surgery often end up with short bowel syndrome of the gastrointestinal tract.
Mhm.
Ileitis results in large volume watery feces, and colitis result in a smaller volume. Severe cases, an individual may have more than 20 bowel movement per day and may need
Yeah.
to awaken at night to defecate. माने
Mhm.
पूरी रात दिन बेचारा दौड़ लगाता रहता है वो टॉयलेट के कष्ट पाते हुए.
बिल्कुल.
The mouth may be affected by non-healing sores.
Mhm.
ये भी अल्सर्स वहां माउथ में हो सकते हैं.
Mhm. Yeah.
Difficulty in swallowing, dysphagia. Systematic symptom: up to 30% of children with Crohn's disease have retardation of growth. ये भी देख लीजिए.
Mhm.
Among older individuals, Crohn's disease may manifest as weight loss related to decreased food intake.
Mhm.
People with extensive small intestine disease also have malabsorption of carbohydrate or
Mhm.
lipid, which can further accelerate weight loss. So weight loss भी होगा. Extra intestinal symptom, ये increase करती, it increases the risk of blood clots, painful swelling of lower legs, can be a sign of deep venous thrombosis,
Mhm.
difficult breathing due to pulmonary embolism,
Yeah.
autoimmune hemolytic anemia, a
Mhm.
condition in which the immune system attacks the red blood cell. Causes. Now we talk about causes. The disease means 30 times runs in families, then 30 times more likely to develop CD.
Mhm.
Mutation in NOD2 CARD15 gene are
Mhm.
associated with Crohn's disease. So our scientists have reached up to the genetic level to identify the genes NOD2 and CARD15. Over 30 genes have shown genetic play in role of the disease. Anomalies mean XBP1 gene have resulted been identified as factor. So many genetic factors are there. Environmental factor are there. Hormonal contraception, it can be linked with, definitely it has increased dramatically. And immune system, Crohn's disease is thought to be an autoimmune disease with inflammation stimulated by overactive T1 cytokine response. So genes are identified. Recent gene to be implicated in ATG16L1, which may induce autophagy and hinder the body's ability to attack the invasive bacteria.
Mm.
Microbes are also there. So many researchers have pathophysiology is there, transmural pattern of inflammation, ulceration, inflammation, the neutrophil leading to inflammation or abscess. Granulomas known as giant cell are found in 50% case of Crohn's disease. So this is pathophysiology of CD. Antigenetic stimulation, microbial dietary antigen, then
Mhm.
it goes to intestinal mucosa, gut immune system, then physiological inflammation, normal host, suspectable host, limited inflammation, healing. Means these all samprapti is there. Section of colectomy showing transmural inflammation. Just see the section of colectomy.
Mm.
Fistula can also there, sore or ulcer be there, abscess,
Yeah.
bowel obstruction, cancer, perforation, toxic megacolon, osteoporosis, joint problems, skin problems, so many eye problems. So diagnosis with does not have diagnosis with complete this certainty. Capsule endoscopy is the diagnosis generally. So this is the capsule endoscopy reports, radiological test, blood test. In blood test, ESR, C-reactive protein, vitamin B12 deficiency, testing anti-sacromous antibody, ASCA, ulcerative colitis. So many treatment in our Ayurveda. What is there? I will definitely communicate. Medicines used generally in allopathy, 5-ASA, prednisone and methylprednisolone, steroids, immunomodulators such as azathioprine, like MS, multiple sclerosis, like other autoimmune disease, they are the system SOP is the similar. So this is the management of this lifestyle changes, surgery, diet, everything can be discussed in detail, nutrient, food. Otherwise, I read one research paper, just see, in by SDM Ayurved College, Udupi, Karnataka,
Mhm.
and they have given this uh, Vilvadi Gulika, Dalimastak Churn, Kutajarist, Takra Kalpana, Parpati Kalpana, Picha Basti, etc., strictly following Laja diet with Takra in 4 courses of admission with a time gap of 2-3 months. So, एक साल इलाज चला, 1 year treated, after 2-3 months, and marked improvement in weight gain, marked improvement in this symptoms of the Crohn's disease. It was observed. So, this is my humble submission to the dais. Now I would like to have expert comment of respected Avatar.
Thank you very much. You gave the very big knowledge. Like this case, I have other cases. I have the same kind of the feedback from them. What you said, very big detail. What I found, this is the all the information you got it, very wise information you have. But on my point of view, after my research, why is the problem that one I'm doing on that one? Actually, if we take the inflammation, as I so many times said, when inflammation is there, how that intestine can become the crack inside or fissure this side of the because we have like a balloon inside. They become narrow when they are swollen. When they are too much swollen, they can become the crack and start bleeding. Then more bacteria, more difficulty for that one. That is everybody know. We have only 5 minutes. I'm not. I first think to take the from the intestine anywhere in the whole body, as you say, from mouth to go to anus. Okay, the same thing is all the same area, work the same system. Take the inflammation out. That is my, how can my result become within 2 weeks, the patient start feeling better. After 3 weeks, 4 weeks, he don't have any pain. Where they already, the endoscopy says they have the cracks inside and they have the area and the so many polyps. Why? Ayurveda in the Kerala, they done very great job. Take 1 year to become the normal. And if we want to more quickly, what is my theory where I work, I take first inflammation out. That is the main cause of every area. Until we not take the inflammation out from, don't give any medication for that, stop the diarrhea or anything. You no need to stop the diarrhea. Give the medication, make the appetite better, digestion system better, and system to take the inflammation out from the everywhere. Inflammation, I don't think if you doing the proper medication with need more than 1 week to 2 weeks, take it out from the body. If you take it out, that inflammation, then results start coming within 1 or 2 weeks. After that one, automatically our system start healing. Inflammation in our body, anywhere in the body, doesn't matter anywhere. Not let our system work properly. That's my theory. On that theory, I work. It doesn't matter any disease. Like you got the list of that one. I send you in my card that 50-52. Now, these kind of added more that one. My theory is exactly the same. Take the inflammation out from the body, help to the appetite, help to the digestion system, metabolism system. If liver, you have, whether they should know what organ is going slow down, you can check very easily from the blood report. Full blood count, take the one medication. If they have the X-ray or anything, you can find out anywhere in the body we can do the heal. Okay, do the healing on any kind of, like same for the cancer. I'm not killing the cancer cell in the body. I made the medication remove from the body, remove from all bacteria from the body, not let try to kill inside. If you give the very strong medication to kill that bacteria, parasite inside, then we can't do it. Take very long time maybe, but the procedure is more dangerous than normal. This is easy procedure. I take it out the all the bacteria, all the parasite from the body, and all the inflammation. As soon as inflammation coming down, immune system start working, oxygen start better there. Once oxygen reach there, all the bacteria, all the wounds, or the scar is start coming normal. That one once start coming normal, then no any pain. That is my theory. On that theory, I'm working that one. I'm not very. I said one recording done. Dr. Bhamra and Dr. Joshi done my recording. They have that one. I told them Ayurveda is very easy. If you know the Ayurveda, no need to very difficult thing. No need to very problem. We need to proper medication. That is very important. Made it properly. Herbs should be properly, not very old. Then they start working very well. This is my, if anybody want to more question, I'm happy to give the answer. Thank you very much.
Thank you. Thank you very much, sir. I would like to invite 2-3 minutes, sir, with us. If anyone has any question to ask? Please ask. Srinivas Banigolji is there, Mumtazji, Ila Patel, Dr. Sweta Kulkarni. So anybody can ask the question directly from the doctor. Ila Patel ji want to ask something.
You're
Welcome,
welcome.
Ila ji.
Yes. So
Hello, Ilaji.
हेलो जी आपने अभी कहा कि आयुर्वेदिक मेडिसिन फ्रेश होना चाहिए तो कितने फ्रेश होना चाहिए कितने
हाँ।
कितने कितने देर तक आप रख सकते हैं
According to Ayurveda theory, they depend on the season. If the summer season, you can keep maximum 6 months. If the season is like a rainy season, you can't keep more than 3 months. Maximum 3 months to 6 months.
Okay, and after that they lose the effect of
Yeah,
healing.
definitely they lose their power, they lose their effect. That one maybe we can't see, that one maybe the rotten.
Right, okay. That's lovely. Thank you, doctor.
Thank you very much.
If we specifically talk about the juices, any fresh juice can be kept up to only 6 hours as per our text. Only 6
Yeah.
hours. If
Yeah.
we suppose make a paste, kalk or chutney of anything, it should be not more than for 3 days. It should not be. Nowadays
Yes.
we have received these fridge and other thing.
Yeah.
If we are making powder of any herb, then if suppose that is very soft herb, that can be kept up to only 1 month. If suppose that is medium herb, that can be kept up to 2 months. And if that is hard material and we are making powder out of it, it can be kept up to the 3 months only. Dr. Avtar sir rightly told about that.
Thank you very much.
Dr. Sucheta ji wants to, Sweta ji, sorry. Sweta ji, welcome.
Yeah, hello, sir.
Hello ji, Sweta ji, namaskar.
Yeah, namaskar. I wanted to ask that what grutas we can use in Crohn's disease? Which grut we can use here?
Which grit?
Yeah.
I don't think so. In the beginning of the Crohn disease, you can use the dairy products.
Okay.
Until your metabolism and system is not start responding properly. But it's definitely like this patient, which one I send all the detail. After 4 weeks, he start eating ghee, he start eating yogurt, he start eating cheese even.
Okay.
Now he told me last night 20-30 gram ghee he eat every day.
Yes.
But don't give in the beginning. Ghee is not good
Yeah.
for the gut issues. Until gut issues is not solved, and especially when inflammation in our body, we have to avoid little bit hard food. We have to give the diet very light water. First, we have to take the inflammation out from any inflammation related problem. We have to be first give them chance the body repair.
So the diet should be like the Langhana diet, which we recommend in Jwara, like
No. Langan, no need Langan. Don't give too much Langan. Already the patient or the Crohn disease are very weak and not eating properly. Just give them like a mung bean, like a small soup or that one.
Yes.
I don't know, vegetarian, non-vegetarian.
Buttermilk, sir, buttermilk is the best remedy for that.
Yes,
Buttermilk
buttermilk is better, but don't
puffed
put
rice.
inside. Put the black pepper or little salt, black salt inside, and put the some jeera on that one, roasted jeera. Then that's okay, but not too much. If they drink the buttermilk, drink sip by sip, or don't drink more than 100 gram.
Okay, sir. Yeah.
If you drink too much, they start bloating too much.
Yes, definitely.
Don't fill
Okay,
up their stomach. When you do the treatment, you can see until appetite is not working, any kind of problem, give the problem to the stomach. First, we have to be, when we giving the medication, we have to be look after the appetite metabolism system. They are the responsible to observe any kind of medication properly. They make the miller. The blood should be very healthy. We have to purify the blood, which one go oxygen on that area where the inflammation and infection.
Yes.
This patient was taking steroid every day. But after 1 week, my medication completely stopped the steroid. They're not taking any steroid. Because within 1 week, his inflammation came down, infection nearly gone, because with the diet is most important with the medication. Medication should be, I make fresh medications, not take it a very old thing. If old things come, I throw it away.
Yes. Yes.
It's not easy,
Yeah.
but not difficult. If we have the
Yes.
in mind, we want to give the good health to our patients,